morning, good afternoon, good evening. Thank you very much for joining us for this interesting conversation on monkeypox. You know, these days it's always one virus or another. And so we thought that would be an interesting perspective to hear about monkeypox from areas where it had been endemic to sort of new areas of the world where monkeypox is increasingly becoming an issue. And interestingly enough, I mean, how it was being managed before is quite different from how it had been managed in the endemic environment. And in the endemic environment, I would like to, so we're very lucky that we have folks from the US, but from Nigeria, one of the endemic countries, and Ghana, which was not an endemic country, but has recently reported cases of monkeypox. So we're very delighted to have this being chaired by Dr. Kechi Achebe, who's the Director of Health and HIV at the Peace Corps and is a member of the US government working on monkeypox issues. So she'll be able to give us a perspective, given the fact that Peace Corps, I believe, is inactive in 60 plus countries. And also, so they have to deal with that while understanding what's happening in the US environment. We also have Professor Dime Ogona, who was the first person to publish a potential sort of sexual relationship in COVID, in monkeypox, which he did over 5 years ago, you know, and so he was also interviewed by public radio in the US on this issue. And it's very interesting that he had noted this 4 or 5 years ago. So maybe if people had noticed what Professor Ogona had published 4 or 5 years ago, perhaps the situation might have been a bit different now. So we're really delighted to have him on board and able to join us. And we also have Dr. Prachi Ranade, who is an infectious disease specialist and epidemiologist, but also is a public health physician at the Peace Corps. So she'll be able to give us a perspective from the US and what they're seeing in their different people they look around, different Americans they look around, they look after around the world. So I am so delighted. So now I'm going to be handing over to Dr. Kechi Achebe, who will be chairing this event. Thank you very much, Kechi.
Thank you so much, Dr. Egbe, and good afternoon to lots of colleagues here I see, and also good morning and good evening, depending on where you're joining from the various parts of this world. So really thank you for, on behalf of Anadesh, I think I can say thank you for joining today's webinar. I'm really excited to serve as the special guest for today's webinar. I will just ask that you put on my slides. I have some slides. So the first introductory slide will be great if you can put it on. So I'll start by introducing the speakers. You know, Dr. Egbe has, sorry, the view has changed. So Dr. Egbe has already started to introduce them, but like she said, just to give a little bit more perspective of who will be speaking today, you would hear from Dr. Dime Ogona, the Professor of Medicine and Infectious Disease, also the Chief Medical Director of NDUTH Bayelsa State. Dr. Prachi Ranade, as Dr. Egbe introduced, is an infectious disease specialist working at the Inova Hospital here in Washington, D.C., but also wears a double hat as the Director of Epidemiological Units at the Office of Health Services at Peace Corps. We would have Dr. Joseph Bonet, who's a Senior Research Fellow at the Noguchi Memorial Institute of Medical Research Virology at Ghana. And we're also expecting to have Dr. Ifedayo Adetifa, the Director General of the Nigeria Centers for Disease Control and Prevention, with us today. So it's going to be packed and I think very interesting information that will be shared. Next slide. So I'll just start with some house rules, which I'm sure you all are very familiar with, but we always have to remind ourselves in this Zoom world that please, all participants, please remain muted during the presentation. All questions should be entered into the chat. Questions will be read during the Q&A period and answered live. And I would just say that I'm actually presenting here, not in my official capacity, but in my personal capacity, but would always, interject with what I do in my official capacity. So before handing over to the first speaker, I'm going to give a brief overview of monkeypox. So on July 20, go back to the introduction slide. On July 23rd, the Director General of the WHO declared the rapidly spreading monkeypox pandemic a public health emergency of international concern. We know to date that there are only 3 diseases that have been made the public health emergencies of international concern. The third one, of course, being monkeypox. The other 2 being COVID-19 and polio. As of yesterday, September 7th, the total of 102 countries have reported over almost 55,000 laboratory confirmed cases and about 400 probable cases, including 13 deaths so far. The WHO decided to declare monkeypox an emergency to draw more attention to the outbreak and to spur action, including a coordinated international response. This could include investing more resources and encouraging nations to share vaccines, treatments, and other resources to contain outbreaks. There are still some unknowns, which I know the other speakers are going to talk about, and Dr. Prachi will be mentioning them in a few, but it's currently less of a global threat than the early days of COVID. So I think we're all happy about that. And as you'll see in a short while from our presentations, unlike COVID-19, monkeypox has a very low fatality rate. Like I just mentioned, there have only been 19 reported cases during this most current outbreak. It's generally treated just by managing symptoms. There are also vaccines. But just like COVID and other health crises, access to medicine is limited and unequal. Some countries do have access to vaccines and treatment. Unlike COVID, this vaccine has been around for a few decades, as Dr. Egbe shared in her introduction. Africa has been dealing with the outbreak of monkeypox since the 1970s, and the current concentration of cases is mostly in Europe and in the Americas. So what does this really remind us? The monkeypox outbreak is a reminder that we need a holistic pandemic prevention, preparedness, and response system. We need investments for surveillance and monitoring so that we can detect and respond to outbreaks quickly. And we need to strengthen our health systems through health workers training, digital health innovations, and access to care for all. Until we do that, more disease outbreaks and deadly variants will devastate already overstretched health systems and hard-hit economies. Next slide. So next slide, please. So I'm just going to talk a little bit about the next slide after introduction. Yeah, the monkeypox outbreak. So let me talk a bit about the outbreak. So since May 2022, the United Kingdom, many European countries, USA and Canada have seen rising cases of monkeypox. Unlike sporadic travel-related cases that occurred in the past, there are currently local transmission in these non-endemic countries. There are two circulating clades of the monkeypox, the West African clade and the Congo Basin clade. I will keep a lot of that conversation to my other speakers. Well, just for you to remember or note that monkeypox was first identified in humans in 1970 in the Democratic Republic of Congo in a 9-month-old boy in a region where smallpox had been eliminated in 1968. Since then, most cases have been reported from rural rainforest regions and the Congo Basin, particularly in the DRC, and human cases have increasingly been reported from across Central and West Africa. Since 1970, human cases of monkeypox have actually been reported in 11 African countries, we'll share the list with you. And the true burden of monkeypox is not known. For example, in 1996 to 97, an outbreak was reported in DRC with a low case fatality ratio and a high attack rate than usual. A concurrent outbreak of chickenpox caused by the varicella virus, which is not an orthopox virus, and monkeypox was found, which could explain real or apparent changes in transmission dynamics in this case. Since 2017, Nigeria has experienced a large outbreak, and with over 500 suspected cases and over 200 confirmed cases, and a case fatality ratio of approximately 3%. Cases continue to be reported until today, and I'm sure Professor Dema will talk a little bit more about it. So monkeypox is a disease of public health importance, as it not only affects countries in West and Central Africa, but the rest of the world. In 2003, the first monkeypox outbreak outside of Africa was in the United States of America and was linked to contact with an infected pet dog. These pets were housed with some rats and dormice that were imported into the country. The outbreak led to over 70 cases of monkeypox in the US, and monkeypox has also been, since that time, monkeypox has also been reported in the United Kingdom in September 2018, in December 2019, in May 2021, and now in May 2022 this year. It's also been reported in Israel, Singapore, and in the United States. As my colleagues will talk about the high proportion that we're currently seeing amongst men who have sex with men. Though the reported cases have been among that population, it is important to note that anyone can be exposed and infected with monkeypox. Monkeypox is not known to be sexually transmitted. It can occur through direct close contact. Next slide. So looking at the global situation, next slide, please. Global situation slide, please. So while the slide comes on, yeah, so looking at the global situation, since early May 2022, the United Kingdom and many countries have reported cases of monkeypox. You will see in the slide that I have shown that there are over 100 countries. There are almost 55,000 lab confirmed cases.